Welcome to All About Pneumonia. Come explore with us the common respiratory illness known as pneumonia. Pneumonia is an infection of the pulmonary system and can be potentially life-threatening if left untreated. Pneumonia is caused by bacterial, viral, or fungal infections within the respiratory tract. Most common infection is caused by Streptococcus pneumoniae bacillus, a bacteria that commonly resides in the upper respiratory tract. The infection typically starts in the upper airway and descends into the lower respiratory tract. Inflammation in the upper airway can restrict airflow. If the infection reaches the alveoli, it can cause them to collapse or produce pus and fluid which will the lungs and reduce the amount the alveoli can exchange gas, which leads to shunt, meaning oxygen does not reach the bloodstream. With the lungs not being able to exchange gas effectively, blood oxygen levels start to decrease and leads to hypoxemia and hypoxia. The brain starts to become deprived from oxygen and neurological difficulties will then start to occur. The organs can start to shut down, and the heart can potentially fail. As the infection spreads into the circulatory system, sepsis will occur and can lead to septic shock. Pneumonia is one of the leading causes of in-hospital deaths per year, in which 6,000 Canadians die from each year. During the 19th and early 20th century, pneumonia was the top leading cause of death due to respiratory illness and the third leading cause of death overall. Pneumonia was first discovered by French microbiologist Louis Pasteur along with American microbiologist George Sternberg in 1881. Both men had identified pneumonia-causing bacteria on saliva from patients. At-risk people who are vulnerable to pneumonia include older people, patients with chronic illnesses such as COPD and asthma, smokers, immunocompromised patients, and generally anyone who is not moving air adequately and exposed to microorganisms that can cause pneumonia. Young children, especially under the age of 1 year old, are at risk of pneumonia. Every year 1.5 million children die from pneumonia, mostly in the developing world. Signs and symptoms include fever, fatigue, productive cough, chills, shortness of breath, chest pain, sore throat, coughing at night, colored sputum either white, yellow, green or brown, and a saturated blood oxygen level below 95%. Patients could be found in a tripod position with signs of respiratory distress. The best action for emergency responders when dealing with patients with pneumonia is to administer low to medium flowing oxygen via nasal cannula or simple face mask, and transport them to the hospital in a semi-Fowler's or straight Fowler's position. Patients could potentially be dehydrated, and if it were the case then utilizing fluid intervention is recommended. Bronchodilators do not treat the infection, however they can be administered to improve the patient's ability to ventilate. Have suction ready in case of fluids. In the hospital, doctors will utilize X-rays to confirm if a patient has pneumonia. The best treatment in recovering from pneumonia is with antibiotics along with the use of bronchodilators to ensure ease of airway management during recovery. If you have pneumonia or know someone who does, please have it checked over by a doctor. Waiting to recover naturally is not advised as symptoms will progress if left untreated. There are vaccines available for pneumonia and have been developing over the years since the late 70s. People who are high risk to pneumonia, such as COPD and immunocompromised patients, are candidates requiring the pneumonia vaccine to lower the risk of respiratory health complications. Thank you for watching this presentation on pneumonia. Please share, like and subscribe for more content.